All right, guys, what's up? We are back. But you know, these guys won't be.
His ankle gets twisted in the wrong direction.
And right there, things are not going in the right direction.
I got bones, I got bones, I got 206, I got 206, I got bones.
First, we have Marcus Rosemy-Jacksaint. I hope I pronounced that right. I'll just call him Marcus RJ. Hope that's okay, Marcus. I feel for you. I saw your injury. Absolutely gruesome. So here we go. He's going. Everything's perfect. Boom! Okay, do you see that ankle? Do you see that ankle? It's hanging. That is a fracture dislocation if I ever saw one. That is brutal. And do you know what happened? Let's take a look.
Got the sound effects.
Why do I do that? Yeah, I still got the sound effects, don't I? Do you like them? My media guy doesn't. Oh well, it's in there. Let's go to this. No sound effect. All right. So what happens in an ankle? So this is your ankle, okay? And for him, it was his right ankle. You saw his ankle. His leg was literally dangling like this when it went over. He was turning and then, and it was dangling. Now, what does that mean? Like, did he break it here? So if both bones are broken, then it's hanging like this, right? Well, according to the report, we don't have the x-rays. So this is a right ankle. It twists around, but that's not what happened in his case. But in his case, what happened is that, again, based on the reports, I have not seen the x-rays. I am not the treating surgeon, but the report says he had a fracture dislocation of the ankle. Now that means that the ankle went dislocated and went out of the joint, and there was a fracture involved. Now, oftentimes what can happen is you break the medial malleolus and the lateral malleolus. So the outer bone called the fibula and the inner bone, part of the tibia, called the medial malleolus, and the ankle dislocates. Now, I'm not gonna break this one because this is a new office and they bought these. I'll wait a little while before I break these bones and joints.
It actually comes off.
Okay, fine. So, in a dislocated ankle, what happens is this, okay? So it comes off. That metal is not normally there. So, that was good. So, but these bones, which I won't break, they don't come apart. Oftentimes you can have a separation. This is your syndesmosis, okay? So sometimes you can have chronic ankle pain or an ankle injury and you have not a dislocation, but you can actually tear the ligaments right in between these two bones. That's called a syndesmosis. In a fracture dislocation, oftentimes the bones can separate, result in a syndesmosis injury, but it can also break the bone here and here. We haven't seen the x-rays, we haven't seen the surgical report, and we have not seen the actual post-operative, post-reduction, post-fracture fixation x-rays. Do you like the word post? I do, because post means after you do something. So that is more likely his injury. And not only that, but guess who else had one?
His ankle gets twisted in the wrong direction. Of course, this is at FedEx Field. Oh, goodness. His leg, everything. I say, we'll show it once. We're not going to show it again.
Oh! Did you see it flop? Yeah, that's never good. Ooh, yeah. That's a bad moment. That's a bad moment. Does that deserve a yellow flag? So, now, in Kyle Allen's case, it was his left ankle. So this is a right ankle. It's not really a left ankle. You can't really do that because the big toe hasn't switched sides. But go with me. Okay.
His ankle actually could have done that after.
That's true. See, now my media guy is trying to make a funny. Was that funny? Probably. All right. So basically, in the same situation, you saw his ankle flopping. So he landed. There was an impact there and he lifted around, and more than likely what happened is this ankle popped out like this. He may have had a fracture on the medial mal when it popped out. Sometimes the fibula or the lateral mal can remain intact, and the report said that he had an ankle dislocation with a small fracture. That makes me think that it was ankle dislocation with a little medial malfracture. Again, haven't seen the report, haven't seen the x-rays. This is just based on the reporting, but they're both out. So in both cases, both of these injuries were fracture dislocations of the ankle. Marcus had a right and Alan had a left, okay? So essentially, without going into the specific details, when you have a fracture dislocation of an ankle, the most important is reducing the joint. Because no matter what the bones do, as long as it's a closed injury, the most important thing you can do is get the joint back in place. So that is critical above all, more than anything. Reduce the ankle. So you have an ankle that's dislocated, all right? Flopping around like this. Now that's never good. Now imagine it's sitting like this. There's skin over here. So it's tenting the skin. That can cause pressure sores. The longer, every 10 to 15 minutes of pressure is a risk of ischemia, risk of neurovascular injury, that means nerve and vessels, because everything is kinked. When it's out, the vessels in the back, on the side, on the front, everywhere are affected and stretched in a manner that you don't want. So, and that's aside from the cartilage as well. The cartilage relies on its nutrition from inside the joint because the cartilage itself does not have blood supply. So if it's out of the joint, then that puts pressure that's undue on certain aspects of the joint, and the blood supply and the nutrition is reduced. So you want to get that lined up as quickly as possible. So you got an ankle that's reduced like this. So what happens in that case is an ankle that's dislocated. What happens in that case, you're basically lining up the leg. Someone often will help you with that, and you're going to be pulling some traction, and it usually pops in. Now, that's going to hurt. Now, it's going to hurt a lot. So you may not be able to reduce it without some supplemental sedation, analgesia, or extra help. So more than likely, it's going to be just lined up in a splint, taken to the emergency urgent care services where they'll start an IV, give some analgesia, and pop it back in. However, in some cases, it can be loose enough that if you stabilize the knee and pop it back in an experienced hand, like this, you could reduce it. But the problem is that even in an experienced hand, the muscles are so tight and contracting that it keeps the ankle out of joint because everything is in spasm. So even if you try and know what you're doing, which I do because I'm a doctor, then you may not be able to get it back in. And that's why you often have to use sedatives. So you give something for pain, something for analgesia, and a sedative to help with muscle relaxation, okay? Oftentimes we use propofol. In kids, sometimes you'll use other analgesics. And aside from propofol, which is ketamine, yes, ketamine, the one that's notorious, but it works great when it's monitored in emergency situations for sedation. Anesthesia uses it, and the ER can administer it. And then once the muscles are relaxed, it literally, you just pop it back in and realign it. It's actually relatively straightforward, but it's kind of gruesome. But hey, that's what we're trained for. So now that the ankle's reduced, if you have a couple of bones, well, then it's simple. It's simple carpentry. That's what we do. We're carpenters. We line up the bone. After opening up the skin, we put a plate on it. We line up the bone, put a couple of screws in it. Depending on the fracture, it could be screws only, plates only. Sometimes you have to put a screw across the syndesmosis that we talked about. And in that particular case, it's a syndesmosis repair. Different ways to do it, whether it's a screw, whether it's a tight rope, whether it's a suture. A lot of different techniques are involved, but most importantly, this whole scaffold structure is broken apart. You just got to put it back together, line it up, put some struts in there, and you're golden. Healing. Now, this is the most important part. We can put everything back together. You know, it's kind of like reconstructing a house, right? No, it's not, because there's not only the construction and putting the parts back. It's the biology of healing. So if you're a smoker, your likelihood of healing is much less than if you're a non-smoker. But there are so many other aspects of healing: motion, recovery, nutrition, rehab, and compliance, making sure that you are not walking on an ankle that was just repaired, making sure that it doesn't get swollen, infected, or any other complications or problems that could happen with any type of ankle. Now, granted, complications are low, but the complication of having an ankle broken and dislocated is a lot worse than once you put it back and have to have surgery to line it up. Tissue healing, collagen healing, cartilage healing, nerve, vessel, contusion, even if they're not ruptured or injured, they can be bruised. So you can have various types of ischemia, limited ischemia, and neuronal axonal injuries, which can take some time to recover from the stretching, pushing, and prodding and eventual repair. And once it's lined up, then it can heal. Typical ankle fractures take 4 to 6 weeks to heal, but the soft tissue rehab and recovery can take several months, because you can start walking on it 6 to 8 weeks, then you have to start running on it probably closer to 2 to 3 months, maybe jogging at first, and then you're maybe getting back into sports next season. Yeah, they're out till next season, more than likely. Well, guys, it is good to be back. I know it's been a while. I'm at a new location. I'm now with Coastal Health Partners with Watsonville Community Hospital in the Santa Cruz County. Different area, seaside, oceanside, lots of sun, lots of surf, loving it here. I don't know what to say. Don't worry, stay tuned, and next week, you're going to be meeting my partner, Dr. Akumu, who's going to go over some injuries with you. So, I didn't know what to say, but I snapped my finger, had a good ending there. Why am I? Stop. Until next time, stay safe and wear a mask.
I got bones, I got bones, I got 200